आलोक मालवी सर।
हाँ जी मैडम बोलिए।
आप मैडम को कोर्स बनाइए। डॉक्टर शालिनी गुप्ता मैम।
ठीक है मैडम।
Yes.
Swati, my screen is visible to you?
Yes, madam.
Okay. So I think I can see there are 27 participants right now. So
Yes.
should we wait for some
Only
time?
2 or 3 minutes, ma'am. Then we'll start.
Okay, for 3 minutes we can wait, no?
Yeah.
I'll just adjust the light and this background once.
Yes, ma'am.
प्रेरणा जस्ट देखो ये कुछ किया जा सकता है जो लाइट पीछे आ रही है इसकी ये वॉल करना है ये वॉल कर लेना ये बेटर है so we will just wait for 2 to 3 minutes na
Ma'am.
Till then we just can have an idea ki who are the participants, basically the faculty
members and research scholar of forensic science, criminology and law background, ma'am.
Okay. So faculty member and the research scholars. Of forensic sciences.
Forensic science, law, criminology.
Yeah, once they join, just you intimate me, so I'll immediately start with that.
Or Poonam madam?
Yes, ma'am. Yes, ma'am.
Please start.
Okay. Thank you, ma'am. Good afternoon to all of you. I, Poonam Yadav, Assistant Professor on behalf of Sri Vaishnav Institute of Forensic Science, Sri Vaishnav Vidyapeeth Vishwavidyalaya, Indore, feels privileged to welcome you all to the second session of Faculty Development Program 2022. Our speaker, Dr. Shalini Gupta ma'am, has joined us. We welcome you, ma'am. And before the session is started, it is my pleasure to introduce to this gathering our session speaker, Dr. Shalini Gupta. Dr. Shalini Gupta is a professor of oral pathology, Dental College, King George's Medical University, Lucknow. She has published more than 100 research papers in various journals of national and international repute. Dr. Gupta has also authored 3 books and 5 book chapters. There are many awards in her credit, like gold medal in BDS and for overall good performances. She has also obtained Health Icon Award for the marvelous work in the forensic odontology in 2017. Dr. Shalini Gupta received some other awards like ICMAR International Fellowship in Forensic Odontology, Dundee University, Scotland, UK, Young Scientist category in 2016, and IMSA Fellowship Foundant Excellence Award, membership of Faculty of Dental Surgery of Royal College of Physicians and Surgeons of Glasgow, UK in 2018. Moreover, 6 patents are also in her credit. She has also delivered lectures in various reputed scientific forums. Dr. Gupta is in the editorial panels of many scientific journals of repute like Indian Journal of Odontology, Indian Journal of Forensic Odontology, Journal of Forensic Medicine and Toxicology, and she is also reviewer of 16 research journals. Dr. Gupta has long research and professional experience and also completed many research projects. So now I will request to Dr. Shalini Gupta ma'am for her deliberation. Over to you, ma'am.
Thank you, Ayush, for your kind words. And really, I'm thankful to Swati and this your Forensic University Vaishnavi Vidyapeeth. I'm really delighted to share my experience on forensic odontology. I think even if in the forensic, before starting Swati, I just want to interact with the participants. Just they have the idea of forensic odontology and forensic science also, I guess.
Yes, ma'am. They have idea about the forensic
So,
odontology and forensic science.
Yeah. Basically, I will just tell them in the advancement in the field of forensic odontology, because with me also there are 2 students who are working as a JRF and SRF, and they are from the forensic science background. So before starting the lecture, I just want to tell them that there is a lot of research scope and there is a lot of funding with the government. So after discussion with Swati, I had added few slides in the last, how you can go ahead with your research, how you can go ahead with your fellowships and your funding agency, even with the new innovation, whatever you are thinking. So I will be discussing a little bit about artificial intelligence, 3D printing, because all of that is going to boom in the latest recent 5 to 10 years. It is going to capture the whole market. So I thank your university, your Vice Chancellor, your HOD, and especially Swati for giving me this opportunity to present myself among the students and the faculty from the forensic science. And even if many of known people like Anupama Raina ma'am and other dignitaries who are speaking, I'm quite familiar with them. So hope we can just listen tomorrow's ma'am's lecture also, and I can add something to your knowledge. So I start with my lecture. Just a minute. I think the slide is not moving.
Yes.
There is slightly, it is hanging, I guess. Yeah. So what I will be covering into this, we will be going with the introduction, then the historical evidences a little bit, scope and purpose, personal identifications, what are the basis of dental identification, technique of identification, identification in mass disaster, how to go for age and sex estimation along with the ethnicity and other parameters, bite mark, lip prints, amylographics, a little bit of fingerprints, that is your area of expertise, role of radiographs, 3D printing and artificial intelligence, and dentist as an expert witness. So just starting with the introduction, this forensic means legal. As you know, forensic is the word in your forensic science also. In the Latin, it means to the forum, because it was the basis of Roman law, where there was a public discussion and debate pertinent to the law. So FDI defines our subject as the branch of dentistry, which in the interest of justice deals with the proper handling and examination of dental evidence, and also with proper evaluation and presentation of all these dental findings to the court of justice. So basically our subject involves management, examination, evaluation and presentation of all the dental evidences which you collect in the criminal and the civil proceedings in the interest of justice. So these subjects can be divided into civil class, criminal sector, research field. So like in civil class, we deal with those people who are doing the fraud and neglect. It's like in the compensation sort. Identification of the dead and living also comes under this category, like in a disaster, because it's not some criminal act, it's a natural, in tsunami, in earthquake. So we have to get the identification of the disease. Criminal sector, identification from bite marks that may be present on the victim or in some inanimate object such as food item. Last but not the least is the research field, which encompasses the academic course for both undergraduate and postgraduate, their training, teaching, and all this relevant to the how we can help the police and how we can help the judiciary with the new research work. So why teeth? Why I'm going and for the whole 1.5 hour, I'm going to talk about the teeth. So every human body, ages in a similar manner, and we have got everything. Like tooth is such an hardest structure, I should say, that remains intact for years and years. It can withstand any trauma, decomposition, heat degradation, water immersion, desiccation. We can get the body, we can get the bone, even bone gets disintegrated, but the tooth is going to remain intact for years and years. And every human being has a unique dentition. No dentition of any human being is matching. Even if they have some special traits, like someone has diastema, that becomes more unique. Someone gets transposition, like tooth positions are not normal. Someone gets extra tooth, supernumerary tooth. So some types of things, there are shoveling, there is winging, there are many anomalies, developmental anomalies also, which are present, and that can be pathognomic for that particular person. Last but not the least, the tooth, which is a very good source of DNA from the dental pulp or from the whole tooth, can be crushed to get the nuclear and mitochondrial DNA, and we can use these things for identification. Starting with the historical evidences where dental tissue has been used for the identification of a diseased or a whoever so required. So in starting from the 1775, it's not a thing. See, forensic odontology is not something I'm talking very new. The first bite mark we have got on an apple during the Adam and the Eve time. So it is, odontology is starting from there. In 1775, that Revolutionary War, Paul Revere was the first dentist in US because he identified many revolutionary soldiers. Then in 1849, mass death at Vienna Opera House, dental evidence was first admitted into court in US. Dr. Oscar Emerdo in Paris, he wrote in the first essay on forensic, like dental art and legal medicine. And he is considered as the father of forensic odontology. Then FDI has also recommended in 1968 to include forensic odontology in the curriculum of teaching institution. Mass disaster, World Trade Center in September 11, 2001, many cases was identified by dental structures. In Nirbhaya case also, the bite mark was taken and one of the forensic odontologists has given his expert opinion. Anijari genocide, rows and rows of human skulls was found in Karnataka, Dharwad during the expansion of the drainage system. Those were all identified. There are many cases, even the Adolf Hitler was identified with his denture. Many, Rajkumars and princes, Raja Jayachand, he was also identified with the, very recently, prime ministers from Pakistan and even if the India, our previous prime minister, Rajiv Gandhi sir, he was identified with the dental identification. So there is a lot of scope and purpose for all this. So what are the main, why we are going for this? We have to keep the management and maintenance of dental record. It can be done manually, it can be done digitally. There are many software like PlusData and all these are coming. You can get yourself trained and you can digitize the whole records. Then identification of human remains. We can compare the ante-mortem and post-mortem dental information. That's what I'm telling. The dental records are very important for this ante-mortem and post-mortem. Then collection and analysis of patterned mark, that is bite mark. But we have to first be so much trained to differentiate between the animal bite mark, or the human bite mark, or the self-inflicted bite mark. So many things will be coming in the child abuse, in the domestic violence, and in the criminal activities. Other recognition of signs and symptoms of human abuse. In that comes child abuse, elderly abuse, geriatric abuse, and age estimation and sex determination. So what are the reasons why we are going for all this identification of human remains? So it can be, the purpose can be the criminal one, like typically an investigation to a crime death cannot begin until the victim has been positively identified. So there we need marriage. Many religious background cannot remarry unless their partners are confirmed deceased. So there we have to prove monetary, the payment of pension, life insurance. Other benefits are given only after the confirmation of the death. Some burial cases, many religions like in mass disaster, they require positive identification before we can go for such procedure. Society duty to preserve human rights and dignity beyond life begins with identity. Closure, like identification of individual missing on prolonged period, can bring sorrowful relief to family members. So personal identification, it's a huge discussion. I can go on speaking on personal identification for almost a week. There are so many structures, but I will just go ahead with the gist of these things. Personal identification is the establishment of a person's individual identity, the characteristics by which person may be recognized. When you mention, like if I am getting a body, I can visually recognize the body. I can recognize them by the clothing, like with jewels, tattoo, or something like some person has gone some surgery, they have got their plates, studs, screws. So all this can be the visual identifying features. Burned or decomposed is very difficult. Once they are damaged, you can't identify visually. So these type of tattoo, jewels, eye color, so these can be used for identification. We can analyze physical feature also, like ethnic characteristics, some surgical scar, as I told, previous fracture, from dental antemortem data, any restoration or procedure or any surgery which that person has undergone. So we can go ahead with it. Physical feature prone to change over time. Fingerprints, again, they undergo post-mortem change. As you people are expert for the fingerprints, but now it has become a part of the DBI also. But dental hard tissue, suppose you have got a filling, dental material, these are resistant to post-mortem decomposition. Years after years, you can get if any inlay, onlay, denture, any FPD, crown, bridge, anything has been done. And dental evidence is the method of choice in especially establishing the identity of badly burned, decomposed, or the skeletal remains. So what are the basis of, as I have already told, no two human beings have the same dentition. It's unique to each and every one. The pattern, the arrangement, the morphology, it varies from person to person. So dental identity, all the characteristics of the tooth and their associated structures, which are individually unique, and they can totally, in total, they can give a unique identification. And they are, as I have already discussed, they are resistant to environmental study, all this trauma. What are the techniques? Comparative dental identification, like it attempts conclusive identification by comparing the dead individuals with presumed dental records of the individual, like oral autopsy, obtaining dental records. We can compare pre and post and antemortem data, dental data, and we can write down a report and draw conclusion. So reconstructive group, again, it's a dental profiling, like reconstructive dental identification. It builds up a whole big thing that here the attempts are made to elicit the age, sex, race, occupation, and that can lead to a probable identification. Last, DNA profiling, which is a 100% proven method. This method is used when dental record is not available for comparison. The technique uses modern forensic DNA profiling method to oral tissues to establish. Here the DNA can be the nuclear DNA, maternal DNA. As you know, the mitochondrial DNA, they are related to your maternal linkage, and the nuclear DNA to your father. Comparative dental identification, that's this we are going for the oral autopsy. Autopsy is a highly specialized surgical procedure that consists almost a thorough examination to determine the cause and manner of death and to evaluate any disease or injury that may be present. So it can be forensic, clinical, or pathological, like we do also. Autopsy is something which is done after death, anatomical and virtual autopsy. Now after the COVID, this virtual thing is coming. Because of that also we are thankful. I'm sitting in Lucknow and I can interact people in Indore and throughout all over India. So it's the virtual platform. So similarly, virtual autopsy, you can take, inputs from your friend in other state or internationally. So these are the things which we have to keep into mind. But there are some limitations also, rigor mortis, liver mortis, decomposed body. So these are the things, because body gets, so after post-mortem we know it becomes so stiff, it is very difficult, even the oral tissue, it is very difficult to examine the oral cavity. Then we have to go for the incision. Then critical examination, as I told you, gender along with ethnicity, build, wound, scar, tattoo. Again, you have to go for photographs, radiographs, fingerprints, fingernail scraping and hair sample may be obtained according to the requirements. You have been, if you have visited the crime scene, many a times from the fingernail also, you get so many, even the fractured mandible, maxilla, dentition, tooth, all this can be recreated. So oral examination is also an essential part for the post-mortem procedure. Rigor mortis, as we know, it becomes very stiff. It is very difficult to open the mouth. So we can use mouth gag. We can give the incision and we can separate. We can enter into the oral cavity. And then we can go for thorough examination, any fracture, any carious tooth, any restoration, any missing tooth, and that can be compared. This is a modified Interpol post-mortem odontograph. I think all of you must be familiar with it. So there is a dental status of human remains and we have to put. You can see this 11, 12, 13, 14. This is the number of the dentition of the tooth. In the oral cavity, if we divide the tooth into, because we have got the upper jaw and the lower jaw, and right side and the left side. So this is just the tooth number, like 11, 1 is for central incisor, 1, 2 is for lateral incisor, 1, 3 is for canine. So whatever things are done in the tooth, we just enter here, any filling, any missing. So we just do the detailed this thing. And these all things are also can be digitized, you know. So obtaining dental records, because if patient has gone any treatment, we can get the information, we can get their status of the person during his or her lifetime. We can go constitute. All these are the dental data which we are getting from the records. This is modified Interpol antemortem otondograph. So this is antemortem here. Already this is filled with your interviewing with the relatives or anything. Whatever is you are having that details. So you can just fill. Is there any cavity, missing, filling, bridge, crown? So you can go ahead with it. So these are the features, like it can show you, these are the antemortem AM and the postmortem radiograph. So you can see yourself, like this filling, this tooth is having the distal filling, this is having the disto-occlusal complete filling, this is having the MOD, that is the mesio-occlusal distal filling. Here there is a restoration, again there is a distal filling. So you can see, you can compare these tooth with the angulation, the tooth. So this is just a overlapping. So most of all, we can just assure ki yes, this is of the same person, same here. This was the filling. You can see the tooth, you can identify the tooth, you can see the filling structure, the pattern, because the X-ray can be, see here you have to be a little bit, your acumen comes into the picture, because when antemortem X-ray was taken, it was taken at a different angulation. When you are taking in the post-mortem, you might take in the different angulation. So an individual with multiple dental treatment and unusual feature has a better likelihood of being identified than someone who doesn't have extraordinary dental characteristics. I will come into detail into this. Like someone is having extra tooth, that is supernumerary tooth, that is pathognomic for that person. Someone is having transposition, like sometimes what happened, incisor or the canine is replaced, then the, like normal dentition, we have the central incisor, then lateral incisor, canine, and then premolar. Sometimes what happens, premolar comes first and the canine comes afterwards. So that becomes pathognomic for that. Someone have the raised canines, you have seen it with the many smiles. So all these features are the unique features for that individual. So what actually we come to the conclusion, we can either come for the positive identification, like taking the sufficient uniqueness among the comparable items, or we can go for probable identification, There is high level of concordance among data that may lack radiographic support. There may be possible identifications, like presume enough information may be missing. Insufficient identification, we can't support, we can't give sufficient data to prove our thing, or exclusion. Like I said, no, this cannot be this person, or I don't match the dentition of this person. So you can go ahead with all these things. So at least you get a platform or you get an idea. Then what is the problem? Why we don't get that's good amount? Because there is an absence of ante-mortem records. No one keep the dentist, even the government is making the rule, like dentist has to keep the 3 to 5 years records with them. And someone will ask, they have to produce it in the court of justice. Then absence of any acquired dental traits for the identification. Like we have not done, like what some dental traits are very common for Muslim, some is very common for Punjabis. So we have to work on that ethnicity ground also. Limitation of storing dental records for certain period. Then poor quality, you are getting the X-ray, but it is not that clear. Many a times we face all this problem. In post-mortem situation, all the teeth may not be recovered. Suppose in the air crash or any trauma, we can get the mandible separated or we can get the only tooth. So that is the thing where it becomes in the fire, irreversible damages can be done to restoration. So that reduce the information available for the comparison. So where actually we need this identification in mass disaster, you know, in any tsunami, any earthquake, that can be natural, accidental, plane crash. It can be criminal, bomb planted. So large number of human remains fragmented, incinerated, commingled. Like it is not you can get a separate. So natural mass disaster, most frequently every time we come across with it, earthquake, tornadoes, eruptions, flood. So there is a problem for dental identification team where the environmental infrastructure is compromised. They contain, because ante-mortem data can be damaged. Because in earthquake, the building, that building that having the record is not, it is totally destroyed. So you won't get that ante-mortem record. The house is totally damaged in flood, and so that can be also accidental mass disaster, any train or plane crash, or but this is a closed disaster. That was the open disaster, or intentional, that bombing, World Trade Center attack. So according to Clark, 50% of identification is from the dental evidence. So they tell that odontology should be a part of the team. So in DVI also, when the person from forensic medicine is coming, forensic odontologist is coming, one forensic science person for the fingerprint, that has also become an important part of that area. And dental examination, generally, when we are going, is usually done, first we go for photography. Like if we get fingerprinting and autopsy initially done, then we can go for the dental examination. There is no problem with the dental part, because I told it's a stable structure and we can go ahead with all these things. Then we go with the post-mortem thing that is responsible for processing the radiographs and also need to arrange the photography of teeth. We need the X-ray also in the post-mortem unit. There can be the mobile portable X-ray, or it can be sometimes some good autopsy center have got the CBCT facility also. Ante-mortem unit is most difficult because dentists need to collect as much as information as possible in the shortest period of time. As I told you, there are many softwares also. Identify, Odontid, CapMe, IDIS. So with these softwares, we can go ahead with identification and we can compare. If you have got the data, there's some little bit hangover with this thing. I'm sorry for that. That's why I have just stopped sharing my video also. Like the internet is creating problem. That's why I have switched off my video, and then so that the audio is much clear. Reconstructive dental identification. As you already described age, gender, race. So we are getting the dental profiling. It's a triad of information. And then we will focus more on antemortem data or records. And this will enable us to have a focused research for the antemortem records. Identifying this ethnic origin from teeth, like we know Caucasoid, Mongoloid, Negroid. So best trait of estimation, the mid-facial region. We can see the shape of the cranium, bilateral projections of the zygomatic arches, shape and contour of the orbit, nasal aperture. You know, there is a definite, you can see with the profile also. So we have got, I will come to the individual one. So there are many genetic and environmental influences also on the teeth. So we have got metric, that means tooth size, non-metric means tooth shape traits. So these metric and non-metric can be judged, and they are generally not that much influenced by this intraoral or environmental factor. That means some person may have missing lateral incisor. So they causes compensatory increase in the central incisor size. So these are the things. Non-metric traits, like I told, shoveling. What is basically shoveling? It is the presence of mesial and distal marginal ridges on the lingual surface. Like if you have studied the tooth, on the lingual surface of the maxillary and mandibular anterior tooth, like on the tooth, on the mesial, and because this is the completely the anatomy of the tooth, we are being a dentist, we have got completely command on the dental anatomy and other things, but other people don't have that. Like you people might have problem with that, so it's okay. But once you know these are the features, you can go for it. Carabelli trait. The Carabelli cusp or tubercle or Carabelli is singular derivative expressed on the mesiolingual or the mesiopalatal cusp of maxillary molar. Like this is an extra cusp. Just a minute, there is a little bit of hangover. Yes. So this is an extra cusp which is present on the first molar. Like we have got all the tooth, incisors, canine, premolar, molar. Similarly, when we have three cusp maxillary second molar, normally the maxillary second molar is 4 cusp. But if there is a 3 cusp, that is, there is a reduced, and it is almost 34%. So in some population, it is there. So we can go ahead with that. Winging. That means it is bilateral labial rotation of the distal margin of maxillary central incisor. This is found in 16% of the Indians. So if it is present in some, and we have got in the antemortem records, so it can be a unique identification. Then cusp 5, cusp 6, cusp 7, because these are some occlusal tubercle present on the tooth, distal marginal ridge. A dentist will be the one. I will not go into detail of this, but I'm telling you, these are not the normal structures which we found in the oral cavity or in the dentition. So if we found all these things, that will be unique to that person. So I'm not going into detail of this. Again, mandibular groove pattern also, because sometimes we have Y groove or X groove or plus sign in the groove. So that becomes identification for that purpose. Generally, mandibular molar have 5 cusps, but sometimes in some person, we have got the 4 cusps. So again, that becomes pathognomic for them. So this was the one which I was telling, Carabelli. This is the cusp of Carabelli, which is extra normal. Maxillary central incisor, molar, we have 4 cusps, and this is not present. So this is cusp of Carabelli. You can see from the laterally, this is an extra cusp. Then again, there are many features, as I told you. Caucasoid have the V-shaped arch, and 30% of them, cusp of Carabelli is seen. So it gives a idea, or we can keep this thing as a probability that it can be there. Then again, mesiopalatal cusp, there are some differences in the cusp, pit, furrow. So these help us in identification of them. Then shoveling, as I was using that word. So this is the tubercle. Normal tooth is like this, and these are the prominent ridges, like marginal ridges. This is the back side of the tooth. So these are the prominent ridges present on this, and this is the tubercle. So these type of things you can get on the cast also. Must have heard about the Arizona cast, with which all the traits, metric and non-metric, we are studying. Then Mongoloid, again, we know they have the typical faces, you know. Mongoloid we can see and we can identify them with their prominent zygomatic area. Then they have a typical faces of Mongoloid, and we can identify them with that. So there is a groove on, like in tooth also, at the cervical region, like a screw-like or finger-like projection from the cingulum. So you might not be able, because these are the individual features in the tooth, that is generally told in them is double shovel-shaped incisor. So you can just see what are these type of cusp and why these patterns we are telling, Y Fisher pattern, cross, X pattern. So these are 4 cusps. These are 6 cusps. So these are the just tooth cusps. All are different. Negroid, against cusp of Carabelli is present. Bimaxillary protrusion, and both maxillary and mandibular alveolar bone are protruded with incisal slanted labials. So negroid have a typical facial feature, and again there is an increased tendency of supernumerary tooth, means extra tooth. And again lower first premolar generally have one cusp is fine and one cusp is smaller. So they have distinct cusp. So with this dental we come to the DNA. And teeth can resist extreme condition, as discussed before. We can go for, it's an excellent source of DNA from the pulp, and as a whole tooth can be crushed. So applied technique, we can go for polymerase chain reaction. Check chat. And it allows amplification of highly degradable DNA. Even if we get a minor or a very small amount of DNA, we can go ahead with amplification. So this facilitates in comparing the biological antemortem sample from the hair, such as like from the comb, we can get the hair piece, epithelial cells from the toothbrush. So we can get the DNA from them. And they can be compared to their parents or sibling, thus facilitating positive identification. As I've already told, genomic and nuclear DNA, they are located in the nucleus. Mitochondrial DNA present in the mitochondria of the cell. How we can go for the extraction of the DNA? See, being a dentist, we generally go for the root canal treatment. We open the pulp cavity. So one method can be that we can just make the cavity and we can take out the pulp. If it is an extracted tooth, then you can just make a groove on all that. This is the tooth. This is the crown part, the white portion, and this yellowish portion is the root. So this crown CEJ means like crown and tooth root junction. This is the cemento-enamel junction. So here we can make a groove and then we can cut the tooth into 2 pieces, or with a plier. Very simply, you can separate the crown with the root. So we can take the whole tooth and we can preserve in the liquid nitrogen. We can mechanically grind into fine powder. We can get sufficient amount of DNA, anything, but this needs complete tooth to be crushed. That are the disadvantages also. Less destruction method for DNA isolation, like just a minute, slide was going. So we can open the root canal. As I told, being a dentist, we can't destroy the mush tissue. We'll open the root canal. We can scrape the pulp with a notched needle. We say this reamer or file, and then we flush the tissue debris. So it's retained the morphology and physiology of tooth also. So there are, as you have got the fingerprint, we have got the lip print and the palatal rugae also. So just touching it, these type of things, but they are not very much accepted as they get damaged also. They are the ridges on the anterior part of the palatal mucosa. In our oral cavity, there is a palate. So on each side of mid-palatine raphe, behind the incisive papilla, we have got the palatal rugae. So these patterns are present on the diseased maxillary or the mandibular maxillary denture especially, and then they can be compared to their old denture. It's well protected by lip, cheek, tongue, buccal pad of fat, and especially जब trauma या fire होता है, तो it is very difficult to, same as the fingerprint. So it can resist decomposition to an extent, but we find it is most of the time in the burn cases we don't get. So their classification according to Lysel, primary rugae, secondary rugae, fragmented rugae, and we can just analyze the rugae pattern. So they have got almost software, and this computer has showed 97% accuracy. And then we can go for the visual comparison also, like this. Suppose this is the cast of your upper arch. You can see these are the rugae, which we study in the cast. You can go for, they can be either circular, they can be straight, they can be wavy, curved, or unification. So now we come to the sex determination. Sex determination, we can go from the data from morphology of skull and mandible. And I tell you, this is almost 99 to 100% accurate. Then the metric features and the DNA analysis. So 6 traits like mastoid, supraorbital ridges, size and architecture of skull, zygomatic extension, nasal aperture, mandibular gonial angle. This gives accuracy from 94 to 95%. So this can be easily taken for the, and with the tooth, again, we can measure the mesiodistal and the buccolingual dimension. Like we measure the dimension of the tooth in both the parameter. So this is of special importance, and we can add secondary sexual characteristics with it. Canine have the maximum sex difference, canine. That is the, which is very prominent in the animals also. So dental index, we can develop the formula with mandibular canines. I'm not going into detail of the individual tooth because since you people are not having the idea of the dental anatomy, histology and all this thing, so I will just superficially touch. That is the part of totally the expertise of the dentist. So mandibular canine, they're exposed to less plaque calculus, they get less abraded, less occlusal loading, and they remain. Mandibular canine is the last tooth to be lost. So these are the observed mandibular canine index. We can take the mesiodistal crown width of mandibular canine and we can divide. So we can get the index, we can get the standard mandibular index. With these, there are many studies done. They have taken that they're getting some value. If they're less or equal to that value, MCI value, then individual is female. But you have to see this in your population. And this accuracy is 86%. There are other methods also, like these are, see, if this is a tooth, you are measuring the mesiodistal with a digital vernier caliper. And this is from canine to canine. You are measuring the intercanine width. Then similarly, you can measure the premolar and molar width also. There are many studies. Sex determination by DNA analysis, amylogenin, very important protein secreted by the amyloblast. So this ML gene coding is located on X chromosome and Y. So female have 2 identical ML gene, but males have 2 non-identical. So this is almost 100% correct. So you can go ahead with it. Then people are also working in the field of the age estimation we are going. So dental age estimation. Once we have discussed about the sex, and I will just tell a little bit of the sex identification with using the artificial intelligence. Many studies we have found they are doing the scapula. They are taking the this sex determination with the scapula in combination with the left one. Some are doing from the mandible. Like we trained, what is artificial intelligence? We are training the computer. We are learning that, giving that instructions to the computer, all the details. And as the number process, like many mandible, you can give the projective height, you can give the mandibular height, you can give the mandibular width, mandibular gonial angle on individual basis. And then you can tell the age of this person or the sex of this person is this. Computer will almost after the thousands of data, Computer will start. This is the future only. Artificial intelligence is going to remove all that. I will be telling you the formulas for age also. There are so many formulas with the dental and the radiology and even the long bones. So all these things will give, once you take the picture of the X-ray with your mobile or the system, and it is going to tell you that is the artificial intelligence which we are making, which are feeding the computer with the deep learning models. So this type of, with these analysis, we can go for the sex determination also. Dental age, it can be the age in the prenatal, neonatal, children and adolescent, age estimation in adults. So why we are going for all this? Like, I am concerned with the tooth development. We know in the 7th week of in utero, the tooth is developed. Enamel formation is there in the first year. Permanent first molar comes, the germ formation. Like with the X-ray, I will show you the X-ray. With all this eruption and when the crown is forming, this is in detail for you. But for us, all these things are in the fingertip. As we know, the first molar that erupts in the 6 years of age. So any children having the mixed dentition, we can tell the age seeing the is dentition only. Then comes the central incisor from 6 to 7 years. Then comes the lateral incisor, then mandibular central incisor, mandibular lateral incisor. Then canine comes afterwards. 10 to 12 years, premolar come. Then we can go for the canine, lower canine and then upper canine. Upper canine comes almost around 13 years. Then first maxillary and mandibular molar, they erupt by 6 years. Then the second comes up to somewhat around 13. That's why when the third molar is not erupted, that generally erupts by 18 to 25 years. So these, all this calcification, all this eruption, so various method has deployed them and tried to take out their own formula. Like they have taken tooth calcification. Like we know, we have got 2 sets of teeth, deciduous teeth also and permanent teeth. Deciduous tooth, first tooth erupt in our oral cavity in the 6th month. And all deciduous tooth comes by 2 to 2.5 years. After that, there is a mixed dentition. Unless and until all the deciduous tooth are exfoliated. So depending upon the third molar or calcification, there are many classifications. So we can, with the help of the radiographs, we can see the calcification. We can, which is generally not altered by any local or environmental factor. And we can very easily and very accurately, we can tell them. So what are the advantages? This simple, easy to master. Once you have the knowledge of dental anatomy, you can go ahead with it. It's a better indicator in the first 2 decades of life. So this is the demergence method. You can see they have divided one like common, this molar. Only the cusp tip has come. They have not even coalesced with each other. Then mineralized cusp united. Then the crown is approximately almost half formed. Crown is completely formed up to the dentino-enamel junction. Then root formation begins. All these are divided into stage A, B, C, D, E, F. Root length almost as great as crown height. Then parallel root walls, you can see, and they flare up, but apex is not closed. So all this with this star chart, there is the, you can go, we can compare, we can keep the radiographs, you can compare which stage of the tooth is there. I'll just show if there is some radiograph. So we can label them, then there are some table. You can fit these values. Suppose you got, these are the all the molar, premolar, canine incisor. Whatever you get into your, you take that value. Then for the boys and for the girls, demersion is the most common accepted method. So, you know, it is taken like this. I'm just telling. This is the Cambridge method. So demersion was separate, like crown also we can take out from that system where how much is formed, root are parallel. So here you can see these are deciduous tooth and these are permanent tooth. So in Cambridge also, he is measuring the cusp, the line you draw from the cusp to the root, and this is the widest width of the tooth. If it is a root canal, that is 2 root canal, you will measure this. individual root and the, so there is a formula, Cambry has also validated his formula. So you can also develop, we can also develop in our formula, in our population, our own formula. So Cambry has validated all this formula in the Italian and European population, and it is well accepted at many places. But we have to check at our, so again, third molar, as I told you, it is 16 to 23 years when all the 4 molars already have erupted, calcified. So generally we take 18 years is there, 96.3% is there, male and female. So accuracy is 96 to 95%. Generally premolars, this third molar, this thing is not accepted as it is getting the vestigial organ and their eruption pattern is not similar in everyone. Sometimes it is impacted. It's quite questionable. And again, another method of Guns and Misselton, they have again developed how much crown is formed. You can see half of the crown, 3/4 crown, then root has started, 1/4 of the root, half root, 3/4 root complete, then apex is half open, apex is closed. So they have given like 1 to 10 staging. And then you can fill in their table and you can come out with your formula for male and for female. And you can check these methods in your own population. So this age estimation, so many methods are there. Gustafsson method is there, dentine translucency. Like if we make a thin section of the tooth, we can check the dentine translucency. All these are histological and this parameter. I know it will be difficult, those who have not have the idea of dental anatomy or dentistry, but you can have an overall idea. Yes, these are type of things are there. Incremental line of cementum, again, histological technique, amino acid racemization, and the radiographic method by Kaval. So like Gustafsson measures the 6 criteria. He's checked the how much attrition is there, means the incisal edge of the tooth is, they are getting it treated. Coronary secondary dentine deposition. There is a loss of periodontal attachment, cementum apposition, root resorption, and dentine translucency. And then you can fit all this into this formula. So these are the just Johansson has modified it. Dentine translucency. See, root dentine is translucent till the 3rd decade of life. After that, it becomes calcified. We can start getting intratubular calcifications. So with some radiographs also, I'll just show you this. Age estimation with cementum, again, accuracy within 2 to 3 years, incremental line. They're the hypomineralized bands. Then radiographic method of Kaval, they can measure the pulp. So you can go ahead with the pulp. All these things are like tooth related, so I'm not getting into the details of this because it will be difficult. Amino acid racemization. So this is a little bit of invasive process. You can't go like all this radiographic method, you can go ahead in the living individual also. It is not going to harm that much. But in the dead individual, you can go ahead with these techniques. But in the living, it is a question of ethical issues are there. So racemization with aspartic acid, we can see, and it gives age within ±3, which is not that accepted. So optimal dental estimation, we should see the investigator, like I should have the, when I'm going for the tooth, I should have sufficient experience. Second opinion is important. Multiple age estimation method, like I'm using Demerjian, Cambry, and some other Williams, or so we have to use 2 or 3 method, multiple tooth, and we have to adhere to the protocol. Why we are so much concerned about this age estimation and all these things? Because there are some issues also, like MTP Act, fetal abortion in 1st trimester is illegal, or it is safety. If mother safety is there, then it is legal. We can go ahead with it. Termination, 4-month intrauterine is illegal. But in some criteria, if it is justified, because most of them go ahead with the boy or the girl child. That is the problem. Less than 7-week intrauterine fetus killing, it's feticide. Infanticide, 7-month killing. Stillbirth applicable to child more than 28 weeks. So it requires doctor's certification. So these kind of things are less than 7 years, not criminally liable. IPC section 82. 7 to 12 years, again not criminally, is liable, IPC section 83. Less than 14 years, child labor, because if we are getting the child who is less than 14 years, then it comes under the Child Labor Act. 15 years, adolescent can work in the factory. Then sex with the female less than 16 years, even with the consent, is come into the IPC section 375. It will be considered as a rape. Marriage, 21 years for male and 18 for female. It is different for the different countries, and their standing committees proposing to raise the age for the female to 21. So that is, then again, artificial intelligence. As I told you, what is artificial intelligence? Like, we are getting the data, we are getting the questionnaires, we pre-process it, feature selection, missing data, we will make the model, we can select the best interpretable model, then we will validate that, and then we can go for the prediction and the interpretation. So as I told you, for all these X-rays, we can feed the computer with this. This is the age, sex, and all the details of this person. And then computer will, like we are already working in the artificial intelligence with AKTU here in Lucknow and IIIT Allahabad. So we are giving them the X-rays and all this, and how to interpret, how to take the tooth and all the details of that. And they have got the supercomputers, and they are going ahead with all this modeling and this making the deep learning algorithm. So for the sex, we have got almost 93 to 94% accuracy, and that is very good. As you have seen in our other procedure, it was 85, 86%. But with the age, there we are getting a little bit, we have to validate it more. With age, because if you don't get a variation between +6 months to 1 year, more than that is not accepted. Because like a person is a adult and he has done a heinous crime, even at 18, he will be getting punishable, he will be coming in the punishable offense. And if the crime is very heinous, like it was in the Nirbhaya Kand, so 16 years he will be not treated as a juvenile. So for the juvenile justice, that 16-year age has come. So basically, we are using convolutional neural network. That is a deep learning algorithm. We are giving an input image, assigning importance. We are taking care of all the bias and giving the object image. And then CNN is efficient in recognizing the algorithm that is widely used. And it helps in the pattern recognition and image processing. Many features such as simple structure, less training parameter, and adaptivity, we have to choose that. So it is supervised by deep learning and image recognition and computer vision. So the artificial intelligence is not a very big issue. You can also work in that. Artificial intelligence, you have to have a huge data, and you have to have the supercomputer with all the softwares. So age estimation, same thing we are also doing, and many other people are also doing. They are just validating the most accepted is Cambridge method, which is widely recognized and accepted. So machine learning method can improve the accuracy. Various scientific publications are coming out using their machine learning algorithms with the traditional formula. Again, the bite mark, which is sometimes it is very helpful, sometimes it is questionable. With the Innocence Project and other things we have to take. So during the sexual attacks or the homicide, rape and child abuse, we get different types of pattern. So ABFO defined bite mark as pattern left in an object or tissue by the dental structure of animal or human. So you have to differentiate which is an animal bite mark or human. That again take a full whole day. So the size, shape, pattern, biting edge of anterior tooth, especially canine to canine is very prominent. Very rarely premolar comes and hardly molar comes. So agents can be human, animal, and it can be anything. So as I told, first bite mark was seen on Adam and Eve, apple, so almost long back. So it is not. And what are the classification? It's tooth pressure mark, tongue pressure mark, and tooth scrape marks. We have to take care of all these things. Then we can get a type 1 like limited tooth penetration, then type 2 almost considerable food penetration, type 3 complete penetration. So these are some classification, and from where we can get, as I have told you in the sexually oriented bite, child abuse cases. But why bite mark is so questionable? I'll tell you which direction you are doing, how much pressure you are doing. Soft tissue is there, so there is a chances of distortion. With healing, there is fibrosis, scar. You have to take care of self-inflicted bite marks also in the domestic violence cases, or mentally retarded or psychologically, sometimes inflict themselves. So these are the bite mark. You can see the central incisor is giving the rectangular mark. Then these are the incisor. Canine gives the triangular mark. Premolar and molar, very rarely it goes up to that spherical or the point shape. Or if you have some like fracture, rotation or spacing like this, in this person we can see there is a gap between the tooth. And every time it is not, otherwise it is, see here it is very closely associated, but there is sufficient gap. So this type of circular or elliptical mark, which has got both the upper arch, this is the upper arch of the tooth and this is the lower arch of the tooth. So there can be central area of ecchymosis also in sucking action. There can be, you can get the DNA also from the saliva. Even the latest research are developing, they can get the bacteria also from that, and you can culture that. So latest advancement are coming. The sites of bite mark, generally breast, abdomen, thighs. Men are usually bitten back, arms, shoulders. Self-defense, you may bite on hand or arms of an assailant. So what are the factors? Why we are telling ki it is questionable? Because where it is biting, it is loose or with excessive fat. So bruising almost lead to poor definition. Fibrous tissue or with high muscle content. So that bruise less, but definition is good. Age, infant and old individual bruise more than the other age groups. Females tend to bruise more than the male. So like this, some studies are there, medical status, time, when they have got, there is a swelling, there is a discoloration, then it may contract, harden, decompose. So many factors are there. So description of bite mark, collection of evidence from the victim, collection of evidence from the suspect, and bite mark comparison. So you can go with the living and deceased victim following the vitals. You have to put all the demographic, name, age, sex, race, case number, everything, location of the bite mark, anatomic location, contour, skin, underlying tissue. And then shape of the bite mark, as I told you, round, ovoid, crescent or irregular in shape. Color of the mark, different skin tones. The bite mark will have different color. Size of the mark, both horizontal. This is the ABFO scale, which you can see. So you can see the bite mark and you can appreciate the tooth pattern. So type of injury can be petechial hemorrhage, contusion, abrasion, laceration, avulsion, incision. So properly how you collect that? You have to visually examine, you have to take the photograph, close-up photograph, oriented photograph, saliva has to be taken for the DNA, and then we can go for the impression of the bite mark. We can make the cast and then we can manually, we can compare or we can go with the software. They're the automated software. But with the Innocence project, this bite mark is always in the question. And we have to very much clear about whether it's a human or a non-human. So there's generally scab formation, telatinars, then central epithelial regeneration, and subepidermal granulation and regression. So these are the changes you can see. You can see the bite marks. Once it is healed, so it becomes more, there is a scar. So it becomes difficult. So methods of bite mark analysis, there are so many. Odontometric triangular method. I'm not going into the details of it. You can go with the vernier calipers. You can go with the computer digitization method with Adobe Photoshop. Then you can take the photographs. You can make the models from the suspect. These are all the models. Direct method or indirect method. You can trace clearly on the acetate paper. So life-size bark bite mark. You have to take care of that magnification error also. So again, we're doing this. We can go for positive identification. We can go for possible identification or we can exclude identification. There is no match. Then other ways to operate, as I told you, we are getting up to the three-dimensional, like 3D printing is coming into the 4-dimensional imaging technology to capture DNA and bacteria. As I told, you can recollect the bacteria from there. And you can, new techniques, 3D imaging, UV and IR photography, digital processing, artificial intelligence is there. Some wrongly convicted cases on bite and the person is exonerated after 19 years. So because of these, some innocence project, the bite mark came into question. All of you know this. I'm not going into the detail of this. Forensic discipline questioned by a White House panel because of the bite mark. So many people are not safe with this. Chiloscopy, again, it is same as you do the fingerprint, it's the lip prints. It can be done in the closed mouth position, open position. You can take there is a classification, straight line, curved line, angle line, bifurcated, trifurcated, anonymous. And there are many other classifications, and you can develop your own also. There are aluminum powder lip print also. You can take with the lipstick. So these are type 1 clear-cut vertical grooves. Then the vertical grooves are there, but they don't cover the entire lip. Branch groove, intersected reticular groove, and that cannot be morphologized. So you can classify and you can put into your whatever you are getting. With the latent bite marks are not considered. Why they are? What are the disadvantages? Major trauma can result in scarring, then render to correct any abnormality that affects any surgical treatment is going to change the pattern. The print produced may be differ depending upon the pressure applied and its direction. Again, amyloglyphics, very important. The study of the enamel rod pattern is known as amyloglyphics. Basic structure as the enamel, again it is a tooth structure, because whatever I am speaking, it is more related to tooth. So I'm quickly going superficially because I know you in audience we don't have any dentist, so it becomes very difficult to understand the morphology and histology of the tooth structure. But anyway, you can have an idea. As I told you, tooth is the most indestructible component, highest resistance is there, the positive tool for the personal identification. So these tooth prints are also used as is your fingerprints. You can just see is that the circular, they are aligned in parallel, there is a keyhole pattern. So this we can go orientation of enamel rod. These are all histological structures. So what are the acid used? I'm not telling you the detail of the peel technique is also there. Simple, inexpensive, like this. We are scaling and polishing, we are putting the etching orthophosphoric acid and then rinse with water, and then we can take apply acetone, and then we can take cellulose acetate paper. So then again tape, and we can get the pattern, and the digital image can be taken. So it can be used as an adjunct, simple, inexpensive, and rapid method. So what are the molecular techniques? Great, many work has been done. The time elapsed from the moment of death until the cause is discovered is known as PMI. So DNA and RNA, all these things are there. Since we are having our own project on this, so I'm just letting you in the post-mortem interval, there are other methods. So it can be classified into immediate, early, and late stages. So what is the importance? Component, medico-legal investigation, both civil and criminal cases, to confirm or disapprove credibility of the suspect and the moment. I think ma'am will be taking the complete DNA part, Anupama Raina ma'am, that's why I'm not going into detail of that, but some molecular work in which we are working on post-mortem changes, that's why I'm just touching this topic. So immediately you get loss of voluntary power, cessation of respiration. Early you get pallor and loss of skin, eye changes, rigor mortis, cooling of body. Late you get putrefaction, adipose pore, mummification. So there are many methods, concurrence method, the rate method, but there are limitations also for this judging the PMI. So since one of our molecular approach to judge the PMI with the DNA, RNA, protein, one of our project from ICMR is also there. 2 forensic science students are working on that. So we have to, molecular profiling is very important to understand the gene expression and to reveal more accurate the PMI. So what are the factors that affects this approach? Storage conditions, sampling, investigated protein, and many other things are affecting this. So we were going with the DNA. I'm not going into the detail because it will be covered by Anupama ma'am. So I'm leaving these portions of the DNA and molecular approach, but human teeth samples at different condition and dental samples, we will put it on like maybe the different temperature, humidity. So we can keep all this and we can go for the study and we can see what some limitations also. Rate of DNA degradation, they vary in the sample from different organisms. Mainly animal model we are doing and studies are focused on that. And post-mortem factors on DNA degradation. There are more target organs and generally it is mixed. So molecular approach with protein also, most probably ma'am will be covering. So I'm just superficially touching because in forensic odontology with the tooth also, we go for, again during decomposition, protein also undergoes successive decay. So there may be abundance of protein present in different tissue. Various molecular approaches, which we go for the PMI, immunohistochemistry, Western blotting, mass spectrometry, then subsequent photometrical analysis, casein zymography, ELISA. So these are the molecular approaches, especially in the protein, where the plasma protein, hemoglobin A, transferrin, lactoferrin, they decay fast between 1 and 4 months in PMI, whereas the myosin, they decay slowly between 1 and 2 months. So all these approach, you can go ahead with that individual methods and you can, but there are some limitations also. As I told, all these were done on limited tissue, lung, kidney, bone and skeletal, and high quality study in human is not possible, is rare, except for skeletal tissue. So we are, the findings which we are getting from 2 method or 4 tissues, so we can't conform with that. So we are doing with the tooth also, even if you can go ahead with the RNA approach. So I'm not going into the details such as messenger RNA, ribosomal RNA, microRNA, and you can go with the circular RNA also. So molecular approach, we are also going one study for human dental pulp for estimation of PMI. That's why I just touched it. We can just keep the PCR based results. Other studies are also there. You can, that LV et al. Has shown that beta-actin correlates with prolonged PMI both in liver and heart. And Tao et al. Has shows CDC25B was found to be more sensitive marker in earlier. Faz et al. Has shown that the correlation of HIF1 alpha protein and mRNA with PMI. Child abuse, again, is defined as any act of commission that endanger, where how the dentist is going to help in that. Because dentist is the one who check the oral cavity and get the sign and symptoms first in the, and it's a duty of a dentist, if gets any sign and symptom of child abuse, they have to report it. We can get any injury on the craniofacial head and neck region. We can interrogate the intraoral and the perioral examination very nicely, you know, because oral structure like lingual frenum or labial frenum, we get there is a torn, generally it doesn't rupture. So these are the frenum which connects the tooth, that gingiva, with the our labial tissue or the lingual tissue or the tongue. So basically we have to see the contusion, the burns, the laceration. The child is giving the history of ecchymosis, bite mark, or any type of trauma again and again, many scar on his or her body, ecchymosis, abrasion, laceration, anything found on the ovoid or elliptical pattern. So we have to document and report child abuse whenever we suspect it. And with POXO also, government and agencies are also working very. So as I told, radiographs we are doing, they are helping in the age estimation. We are developing, assessing the age and the tooth eruption, evidence in identification of suspect and cause of death. All these are just the repetition which we have done. So radiologist, we will get now the 3D printing, a change, you know, 3D printing is going to change the whole scenario in the coming years. Like 3D printing within forensic, how we can, and I will be very much surprised how we can it can help in the 3D printing in forensic. When it came, like we had that machine 4 to 5 years back, then I proposes that we can reconstruct the tooth, we can reconstruct the facial vein, we can reconstruct the face. So common printer, because we have to start with the 3D printing, so I have to tell you that it's a 3-dimensional solid object. We have got an additive process. You can prepare the 3D printer yourself also. So it's got a 3-axis on which it prints. So where we can go for it, surgical planning, implant and prosthesis, surgical guides and tools. These are the things which we are going simply for the medical application. And there are so many things you can go for, even if for models for education and training. You don't know 3D printing or like bioprinting, which is coming now. It's going to change because even the drug test, drug applicability, even the cosmetics, they are using the 3D printing for this thing. Tissue engineering, we can go with it. Material development, if you want to, any disease modeling, even the cancer and personalized medicine, organ on a chip, you can go with the 3D printing, space biology, food alternative, soft robotic, what and what not. So 3D printing is going to change the whole, because like after this, people will inject the cells also, and they can, even they are getting reconstruction of the liver, heart, even the brain model. What forensic with 3D geometrical modeling and 3D printing, you know, our area of concern is this. So it's a boon to revolutionize the justice system. We have to take care whether it is acceptable also in the judiciary or not when you're recreating the mandible or the maxilla. Or, like, see, before COVID, the virtual platform, the virtual tele-health services, tele-dentistry, telemedicine, all these were not accepted. But now it is working and it was accepted during the COVID era. So similarly, when we are working with this, so maybe in due course of time, it might be recognized and it might be accepted in the judiciary system also. So you can make the 3D physical model, you can reconstruct using the 3D printing. Bite mark you can take, you can make, so it becomes very easier. You can discuss among victims, suspected person, lawyers, and you know, higher level of interaction by the observer. Since you have that 3-dimensional, even now the era is coming of the 4-dimension, and any object can be scaled down to fit into the 3D printer, which is easier to hold. So alternate to duplicate fragile objects, also the missing elements, suppose one part is not there, we can recreate with the 3D printer. You can digitally match clues such as suspect's teeth, lip prints, fingerprints, footprints, identification of face, pattern of fracture and reconstruction. So all these things are, so 3D printing is used to open cold cases after using the CT data. So all these are presenting an information to the jury for making understanding all aspects. Virtual 3D models offers humanitarian approach, especially in the disaster side for forensic, because it is a non-invasive, non-contact data. You have to just scan it. You have got an extraoral scanner and just scan it. And there are very cheap extraoral scanners available. For individual tooth, we need intraoral scanner also along with the extraoral. So for that is for the tooth reconstruction, and it is related to the tooth. So recreating 3D geometric model for analyzing or bringing hidden information on the, so like you can take the scan of the whole crime scene and you can recreate with 3D printer. So faster collection, transportation, examination of multiple experts with ethical issues. So many things are, but there are some disadvantages also. The transportation of human beings is strictly governed by laws. There can be loss of data, safety issues, loss or destruction of evidence is a punishable offense. Reconstruction of the crime scene you are doing, you have to take prior permission. Reconstruction of the weapon and analysis. So these are whatever we are presenting after the changes might not be acceptable to the family of the victim, or only photographic representation may be used. Presenting evidence in the court of law, 3D replica allows for the visual representation of evidence that otherwise would not have been able to the presented. Like हम उस चीज को ला नहीं सकते कोर्ट में, लेकिन उसका replica we can present there. Anatomical model, analysis of crime, investigative tool, analytic phase where religious or cultural beliefs prevent maceration of the skull. So we can create physical model of the scene creation. It is already very popular in dentistry. We are doing so many other things. In the beginning, we tried to apply this for the identification of the individual, disaster 3D reconstruction, facial reconstruction, digitized missing part, assembly of the fragmented, bite mark analysis, age estimation. If you have the 3D model of the mandible, you can use for the age estimation, especially for the gonial angle, sex determination, measurement of the intercanine distance, intermolar, the overjet, the overbite, size, the arch length. Even in the chiloscopy, rugoscopy, you can do the geometric matching, bone pattern injury, ballistic injury. So in bite mark analysis, you can take this is the ABFO scale dynamic process release, and because bite mark, as I told, is a multiple factor: position of the jaw, teeth, the number of teeth present, pressure of biting, size and shape of tooth. So 3D printing bite mark can be compared to the suspect dentition for the purpose for inclusion or exclusion. So healing can cause some distortion and we can lose the valuable information. So this technology may be very useful in cases where taking an impression is difficult, such as soft tissue, breast, buttock, where you will apply pressure. And so you can get like this, you can play with this model and then you can get the replica. The digital scanning can be carried out to create, and you can see this is the incisor, lateral incisor canine. So using 3D printing, they can be compared with the suspect. You can take his pattern also, pattern, palatal rugal, lip print, tongue print, pressure, so many. These are some case studies where they have solved the cases using the fragments, and it was proven. So combination of microcomputerized tomography scanning, all these are available, and 3D printing, 3D virtual reality. In the UK, first in forensic, and eventually. Again, in 2013, Japanese police has also solved some cases using the 3D printed model of crime scene. Then 2016 in Ohio, USA, decomposed body where it was very difficult to identify. There is no, they have taken help from the 3D models to aid in the identification process. Then some tooth, he was killed, and this was in 2015 in England also. In 2019, there was innovative digital approach of forensic tooth reconstruction. So using 3D printed tooth retrieved from intra-alveolar morphology. So these are the just tooth recreated. New York police also solved one murder case using the 3D printed model of the victim's skull. In forensic facial reconstruction, you must be having a little bit idea. I'll just go quickly with it. 3D facial, as the time constraint is there. Facial reconstruction, you must be aware, being a forensic science student, many of you are doing facial reconstruction. So based on antemortem photographs, and the skull is to be reconstructed. We can scan the whole skull, and then, because see, we are very much acquainted with the tissue depth thickness, and you can two-dimensional facial reconstruction was done manually. And tissue depth thickness you can get, you can take as your thesis topic. You can take out the, in your population, how much is the tissue depth thickness, and then these are the video superimposition of the skull. But see, there we need a three-dimensional. Any good artist can go with the reconstruction of the face. Like it require phase 1 technical phase. You receive the skull, gather case information, prepare and protect the skull. You can glue the mandible to the cranium. You can place the skull on adjustable stand, orientation of the Frankfurt horizontal plane, cutting and applying tissue depth marker. You can put that, you can put a prosthetic eye. And then with the clay also you can artistic phase, development of mouth, eyes, nose, cheek, ear, all the texture detail. You can prepare all this hair or wig finishing and photography. So these are the tools which are required material you can go for. These are for the manual one. The manual 3D reconstructions are also there. There are many methods: American method, tissue depth method, anatomical Russian method, combined Manchester method, and then computerized 3D facial, forensic facial reconstruction. Then 3D printing is there. So I'm not going into detail of each method. You can just go ahead with it. So you can just see combined Manchester method is a nice method. You can put the tissue depth, and then according to the facial muscles, you can put the clay, and then you can reconstruct. Computerized, you can go with the free-form modeling plus TM, sensible technologies. Some softwares are there. Some softwares you have to need the haptic feedback system, haptic device. You have to do the reconstruction, and it is totally practitioner skill that creates multiple images. You can see the reproduction of the facial soft tissue after laser scanning. 3D reconstructed CBCT image of a skull with facial soft tissue construction. Then on a plaster cast, you can go, that is the Russian method with accompanying tissue depth marker. Just you can recreate. This is the skull with the plaster and then with the tissue depth marker. So soft tissue depth marker, these are the in situ, it is already there. Then you can put, these are the muscles which are placed on the, then modeling of the temporalis, buccinator. All these are muscles, facial muscles, which are orbicularis, oris, and placement of eyeball. Then you can go ahead with the frontalis, levator, superiorlis, labii. So all muscles you can start preparing, and slowly you will get the angle of the mouth, commissure, and orbicularis, oris. You can place everything. So you will get almost the facial. So it is almost dribbling the surface anatomy. So this is the summary. You get the skull, you go take CT scan or ultra extraoral scan, you make a 3D model. You can go with the slicing, Ultimaker Cura, you can make the filament state characterization, optimization, you can go directly, or you can just print the skull and do the facial reconstruction with the software. You can take the Mimic software also, and you can anything. Few free softwares are also present. 3D printed skull using the Manchester method. These are the tissue depth, thickness, and then again on CT based scan model, it has been. See, this is a photograph showing tissue pegs attached to the surface of the skull at the anatomical landmarks. 3D model of the victim's skull. Then again, a soldier was imprisoned and died in Durham. Image was revealed through the new digital reconstruction. So these are some 3D printers which we have in our department. We are working, we have got the single filament, we have got the double filament, we have got the resin printer also. So these are the skull which we can print. There's the support. These are some, in surgical process also we are using 3D, just even the advancement of mandible, or if you want to place the mandible in the retributive position, we have to put the maxilla. So just to show how you can do, like here I'm advancing the mandible, and then we can recreate how the patient is going to look. Here we have fractured the maxilla and we can advance it or retrude it according to the need of the patient. So all this software you can play with yourself and you can create whatever you want. So like it is in the 3 dimension. We will analyze, we will put the maxilla back, like the tooth was very much protruded. So we are using here in the dentistry also from the long back. So you can play with the software, you can create new things, you can. So dentist as an expert, witness is an advisor to the court. With all these things, we have to go, we have to give our opinion, draw interference or interpret facts. About the judge, there has the special knowledge. We are taking forensic odontology is not, everyone is aware of it. So we are taking the training also at the JTRI. We are trying to convince them. We require all this testifying for the malpractice cases. Before finishing, I'll just tell few of the research which I'm already doing. So these are my projects sanctioned by the ICMR. Another accuracy of development we are doing with other methods. Even my PhD is almost about to be submitted. I've got the sanction. I've done almost come to the coming out with the own Indian formula. We are going with the AI also. So very soon it will be published. And we can go, as I told, dentine translucency also. We have paper published also on that. We have other studies on other. So you can go for the research I just want to tell artificial intelligence, if you have got the facility, you have got the supercomputers, you have got the softwares, you go ahead with it. It is just the data. You have to give the command to the computer after 4,000, 5,000, 6,000, 10,000 data. Computer will start predicting you the whatever you want to know from them. So these are some common national funding agencies like ICMR, DST, SERB, DBT, CST is our local, you must be having CST at your place, CSIR, Council of Scientific Research, some international funding agency, WHO, Wellcome Trust, Melinda Gates, UNICEF, then any child abuse. Then what are the job career opportunities in research you can get at graduate level? You can get as a attached with the research assistant, JRF, postgraduate level, JRF, SRF. After doing your PhD, you can go as RA, that is research associate, postdoctoral fellowship, woman scientist, young scientist. Government is giving, see, with the innovative ideas, innovative thought, if you want to make something new, you have got the skill, BIREC, BioNest. Government is having a huge crores of funds. You have to have the innovative skill. You have to propose your thing, and there is lots of call. You can go ahead with anything. I'm working with ICRC also. We have developed humanitarian forensic at Gujarat Forensic Science University. So there they have started that course also. And I'm working with different other agencies. I'm working with many NGOs like Samadhan Abhiyan and other. They are working for the people like POXO. With many schools, we are taking the training. So like that way, I'm attached to so many people. I did my fellowship from Dundee University. It's a scholarship from the government also. So it is very easy to go for the scholarship with, 100% scholarship and all these things. In the Glasgow, when I went to the Forensic Science Institute, so there they are doing that mock, this thing, like court session. So it was very knowledgeable. They prepare, they do it in the proper court, after the judiciary is over, and then the judge come there. Judge is original, and then other lawyer and all these things are mock. So they give a real-time experience, how they are cross-questioned, how they will be, facing all this. They have to prove their things. So with the role of a forensic dentist or scientist, whoever is there to collect, to preserve, and to interpret any trace evidence that may help or result in the solution of by any judicial authority. So our concern, being a dentist, being a forensic odontologist, we are concerned with the dental evidence. We are in and out having the knowledge of the anatomy, histology, histopathology, so we know. So we are also telling all our friends and colleagues, and we are requesting everyone, any of the student who are willing, you want to go for research, you want anything, you want to interact, you want me to tell everyone, like any funding agency, any research. I've told Swati, after this, we have got an interaction and we will definitely collaborate. We have got MOU with so many universities, and we are working with IIT Kanpur. We are working with Triple IT Allahabad. Like, this is not something which I'm dentist, I'm a medical side. I don't need anyone. I'm working with engineering people. I'm working with forensic scientists and in close relation with everyone, like fingerprint expert, because everyone, we can correlate. Like with the fingerprint, the scientists were telling me that they can go for the oral cancer, this thing. They want to see, even with the fingerprints, many of them has worked on the just this in the jail people with the prisoners, why they that serial killers, or why their psychological part, as well as is there anything inherited into that they people are doing it because they have got some tendency, or there is something pre-defined for them. So people are going for the research, and you can go ahead with all these things. So I'm open for the question. Any one of you can just ask. I've just seen 3 messages in chat box. Let me post queries they can put. And you can WhatsApp me also. You can take my number from Dr. Swati.
Yes, ma'am. I will post your number in again.
Because I was going into detail, and then I recognized that dental structures are not that much familiar with you people, because we are studying the anatomy. But I'm telling you, many of the forensic science students, they are working with us as a forensic odontologist, and you must be knowing NFSU is coming at Lucknow also.
Okay.
Well, almost 750 posts are there. I'm working with FSL. We are working with medical institutions also. So with forensic medicine people, in many areas we are dealing with. So any question I'm happy to have.
One of the participants want your PPT, ma'am.
I will send it to you, Swati. You can then share. But most probably this is the one thing. There are a few cases that I will remove and then we can send. Okay. And the second thing is that with the dental tissue beta, you can go ahead with that. मतलब ऐसा नहीं है कि forensic scientist हो के आपको dental का, it hardly takes few months to understand, and then you can go ahead with that stream also. Yes. And you can go ahead with the molecular part of it, because DNA, because Anupama Rana ma'am will be covering it. She is my guru and mentor also. She came to KGMU long back, and from tooth she has just taken many workshops here. So like that, we always, every year I do workshop in forensic odontology. Child abuse, like child abuse is such an international burning topic. It is happening with everyone, but no one is speaking, no one is discussing about it. But it gives a social responsibility to us, and we can go ahead with that. So anything, I'm just seeing the chat box also if I could get, otherwise I will think you have understand everything.
Yes, ma'am, you have delivered your lecture in very systematic manner. So I think every person get understand.
Yeah, I have tried to simplify it, and where it was a little bit higher, I have tried to skip it.
Yes, ma'am. Very complex topic in very simple manner you have delivered, ma'am.
I have tried to touch almost all the fields. Still, there are many things.
Yes.
But so what are types of thesis generally they are doing in your institute?
Ma'am, as forensic is multidisciplinary field, so in our institute there are various type of scholars taking various topics, like some of taking anthropology, some of taking odontology also, ma'am.
Okay.
Some are from wildlife forensics, forensic toxicology.
These so those who are doing anthropology and odontology, what topics they have chosen? So, like anthropology, so they are very good if they are coming to the disaster, DVI themes and all this.
Ma'am, some are taking the topic of fingerprint.
That is common. That's what I told you. And anthropology and odontology.
Handprint. Yeah. And in odontology, age estimation from tooth.
Anyone is doing?
Yes, ma'am.
Yes, please tell that student, because where they're taking the x-rays, is it available to you?
Ma'am, he's also dentist, ma'am.
Okay. So he's doing PhD under you.
Yeah.
Great. Then he can just command that, because he has got the knowledge of the dental structure, anatomy, morphology. So all the, because I can't teach them when the one deciduous of the permanent tooth is erupting, when it is getting calcified.
Satyajit sir, raise the hand. I will allow to talk him.
Yeah, please. I will be happy.
Two participants.
Sir?
Two participants have raised their hand also.
Yes. Satyajit sir, you may talk.
Satyajit sir.
Maybe he is not present near the system. I think he's there,
Yes,
Dr.
yes.
Satyajit.
Good afternoon, ma'am.
Hello, he's one of my
Nice to see you, ma'am, after a long time.
How can I? Satyajit is, I thought, who is there who's working on odontology and I don't know him?
Yes, I just wanted to bring it to your attention that I am ma'am student and I am pursuing PhD under ma'am.
Wow, great, great, great. Really good to hear that. And he's very sincere. I have called him also to deliver lecture at my institute, KGMU. He and
Yes.
Amol, they are really, really dedicated, sincere, intelligent. I have no words for them.
Yes, ma'am. Ma'am, as he is the scholar of SVVV, that is why he is not the resource person in FDP.
Okay, no, he's really good because he's doing in forensic odontology in the future. That's what I told, na Satyajit. It's a coming
Yes, we have
area.
discussed, madam.
Yeah, 3D. It's something, we have to come up with this thing. And above all, the bioprinting which is coming, it is going to revolutionize the whole system in the recent coming years.
Yes, ma'am. We'll have to put our attention towards bioprinting and 4D printing. Right now, we
Yes.
are just trying 3D printing with dental models only.
Great.
We'll get it to the 4D printing also, but some facilities I'm just looking for them.
Very good. We'll
Right
definitely
now, I am
visit.
focusing on finishing the PhD topic first.
Wow. Great.
I have been listening to your lecture, ma'am. You have given a very elaborative and
Yeah, that's what I tried to
detailed
touch.
lecture.
She told me that everyone is just have to give the superficial touch to each thing.
You have covered almost everything from the topic, ma'am.
Yeah. So two students wanted to ask some questions, Swati. If
No, ma'am.
No, ma'am.
no. So you
There is
can
no
share the number also if they have any
Yes, ma'am.
doubts.
I will share your number as well as your PPT also, ma'am.
Thank you, dear. Thank you so much.
Poonam, over to
Yes,
you.
ma'am. Yes, ma'am. Thank you, ma'am, for your valuable and useful deliberation. Now, I would like to invite Dr. MP Gautam, Professor, the Western Institute of Forensic Science, to conclude the session. Over to you, sir. Gautam, sir? Yes, sir.
Okay. Thank you, Dr. Shalini Gupta,
Thank
for
you,
your
sir.
excellent lecture. And I am remembering your institute. It is a very good institute. When I went to the Lucknow University for examination,
Okay,
so I
sir.
visited your
KGMU, sir.
KGM.
Great, sir. So please let me know whenever you come next time.
Okay, next
Because
time.
we are collaborating with LU
And,
also, sir.
Your lecture,
Lovely,
in
Professor.
conclusion, I can say that it was a all-in-one,
Yes.
because every topic has so much to say.
Yes.
You have
Every
covered
topic has got almost weeks to get
forensic
individual.
anthropology, you have touched forensic odontology, you have touched. You have also mentioned about the work of Dr. Suzuki, who worked on this lip prints in 1967. When I was in the Saga University, I gave this topic to one of my students.
Okay, sir.
So actually, your approach is very good. I was listening, not a speaker. I was listening as some teacher is teaching to someone. It was a nice presentation.
Thank you. Sir.
Especially artificial imaging intelligence, sorry.
Artificial.
And I am much more impressed with your approach regarding the child abuse.
Yes, sir. We have got a
Yes.
project also sanctioned, sir.
Yes, because the child abuse, we are teaching this thing to the students of the criminology. We also have the criminology, just like in Lucknow University.
Okay,
We are
sir.
also having criminology and forensic science both. So as far as you have told about the role of dentist, it is not a simple thing. It is a very significant and very challenging job. And very fortunately, I listened to you very attentively, and you are very frank. You have already mentioned that however we are doing this and that, but there are some limitations. We forensic scientists understand there may be a molecular approach, there may be any instrumental approach. Still, we have some limitation with our analytical approach, because the same case, same situation, same methodology cannot be applied to any specific case.
Yes, sir.
Okay. So you are also engaged in the research. It is very good indication. And Dr. Satyajit is a very good man.
Yes,
He's
sir.
very
He's a
good
gem of a
student.
person.
Whenever he used to present. So actually, I have seen the formula which you have mentioned about the age and sex determination.
Yes. Sir, but we have to come out with our own population formula.
Yes, I know.
Like if Satyajit is doing so, I will tell him to get it done, because my area is different, his area is different. So he can
Yes,
come out
I
with
know. But the formula, methodology can be same. If I am working on the fire investigation, but gas chromatography can be used.
Yes,
the
sir.
drug identification also. So you have covered in a such a nice way. Actually, it should be divided into 4 lectures. We are much impressed with, and I will talk to Swati, madam, that the separate symposium should be done for this forensic anthropology, forensic odontology, and advances in odontology. And one more thing I could remember, you had been to Ahmedabad.
Yes, sir. GFSU. Regularly, sir.
Because forensic hematology forensics. In this university also one expert came from, I think he was Gambia or Kenya. He was also presented a lecture in Ahmedabad also in the first conference.
Okay.
Okay. So very nice meeting to you. Your approach is very good. You are research oriented teacher. It is a very good thing.
Thank you, sir. Thank you so much, sir.
We will meet again. And thank you very much.
Definitely. Thank you.
Thank you, sir. Thank you, ma'am.
So we can leave. I think it was the last session.
Yes.
Okay. Thank you, dear.
Okay, okay.
Bye, and we'll
Thank
hope
you.
to see
Okay.
sometime. If
Yes,
you are
ma'am.
visiting
Yes,
here,
ma'am.
you're most welcome.
Yes, ma'am.
If I am visiting Indore, I'll
Yes,
just
ma'am.
give a call
Most
to you.
welcome, ma'am. Most welcome.
Okay, dear. Bye-bye. Take care. Bye. Good day.
Take care.
स्वाति मैडम कंप्लीट हो गया क्या वाला सेशन?
हाँ जी, अभी कंप्लीट हो गया है।
तो इसके बाद कोई और है कि
अभी आज नहीं है।
ठीक है, कल है ना फिर?
हाँ जी, कल है।
कंप्लीट बंद कर दूं फिर?
हाँ जी, बिल्कुल।
ओके।